All right. We are live. Hello, everyone. Hello, Balanced Bosses. I'm super excited to bring you this expert interview with Hannah Coffey. And she has a special guest today, actually. Tank is here with us today.
Tank is here. Say hi, Tank.
Oh, and Tank just chewed Hannah's computer cord. So, oh well.
Yes, he did. Oh, well. So, and thank you for letting him be here. If I put him outside the room, he'll cry, and I'll keep an eye on him. And I'm glad I have a full battery.
Yes, yes. So I'm really excited to bring Hannah on because Hannah she's a lot of things, but right now her primary focus professionally is she's a coach consultant that advocates for whole body health in the interdisciplinary synergy between the dental world and the medical world, and how this relates to practice growth and passion and health. And I love this topic because this is something, especially with what we're dealing with right now with COVID and our immune system, this is so important that we can bring this kind of information into our practices and really change people's lives. And so super excited to have you here. And I also know you have a hidden talent of being a kind of a closet professional weather girl. Is that right?
It's, yes, it's just a fun little habit, right? I love the weather. And I just started grabbing my selfie stick, and after a big storm, I'd go down to the beach and just grab my selfie stick and do a report, right? On, if Hurricane Sally had just blown through or whatnot. And people loved it. And it was funny because they said, you're so natural. There's no script. I just, would just go. And they said, you're so natural. You're so entertaining. You need to be the weather girl when you speak professionally. And I thought, I can't, because, I grew up in an era of your professional life and your personal life were very different. Mm-hmm. And that's why I love this perspective of balance, because they're not different. Right. And even when I coach to part of my 5 to Thrive is vision, right? And how our words matter. And our personal vision and our professional vision, they need to mesh, because it's still all one body that's showing up. It's still all one person.
Right.
So we've all had different journeys through this pandemic. And when I think about it, what did I gain out of this is learning to be my authentic self, learning to bring a little bit of that weather girl to my professional persona, if you will, because she's more engaging, she's more fun, and letting that guard down, letting that fear down. It's like, oh, I'm going to say the wrong thing. I'm going to do the wrong thing. It's like, are you going to be human? Really? Are you going to make a mistake? And giving yourself that grace that that's okay. Because it doesn't take away from your message, from your vision, from your 45 years in the industry. Just bring who you are, Hannah.
That's right.
And being okay with that. So it's been a big growth time for me, and I love it. And I apologize for the squirming. But I don't want to
real and raw. We're real and raw here, right?
So thank you for that. And I learned a lot, about that with the vision is, and my professional vision is very focused on, inspiring, influencing others to hear what I have to say and be like, oh my gosh, I want to do that. That's really great. That's important. And do you have your vision? And does your team know your vision? As a team, are we all lined up? Because when you show up in that vision, it's amazing, what can happen. And as I said a few minutes ago, I love aligning that all with, does it mesh with my personal vision? Does it support the lifestyle that I'd like to live and the purpose that I have in my personal life? And when you deep dive and keep unpacking it, if you have 10 months when you're not watching Netflix, right?
Right.
It starts to do that. And for me, it's been kind of amazing, if I may say so, to discover that about yourself and be able to bring that forward.
Mm,
and
that's
and help others with that. Because if you don't have that, you have a job, right?
right.
JOB,
Right.
and you're going to
Right.
work and you're punching a 9 to 5. That to me is not, in my opinion, and I'm not trying to force that on anyone, but to me, that's not what I want to get up and go do. I can go get a paycheck any place, right?
Exactly.
And I did that for years and years.
Mm-hmm.
And things just got deeper and deeper and deeper, as I went on, and I just really fell into this and love it and live it.
Yeah. Well, and it's so true. I think that there's a study out of Harvard that talks about, and it was with physicians, but it talked about physicians that do something that they're passionate about, something that brings them fulfillment, at least 20% of their day. If they do that, their rate of burnout is half that of other physicians that don't. And so I think that translates with dentistry too. And like you said, having that vision that's part of your personal vision, be part of your professional vision, allows you to bring more joy to your day at work, which then reduces your rate of burnout for sure.
It does, and it really changes the energy of the day. Right?
Yeah.
When you're all showing up, you get together as a team. What's the doctor's vision, and what's everybody else's vision, and really, it changes the dynamics because it gives purpose to why you're there. As Simon Sinek, we all know what you do, we all know how you do it. Why do you do it?
Why?
I truly love diving into that. Why do you do it? Because again, it's eating my cord. It's
real and raw.
And that to me, it really resonates. And I love helping teams unpack that. And if you would have asked me 5 years ago, what's your vision? I'd have had your cookie cutter boxed answer, and here's my vision, and here's why I'm in dentistry. But the more you learn and grow, and the more insight you get into it, it's profound for me.
Yeah.
So to be able to help teams to discover that and give them that feeling, it changes everything when you get to work.
Yes. Well, and I think
it's how you're with your patients. It changes how you look at your metrics. It changes how you look at, pick a metric. I mean, any single one. We just came out of Jumpstart, and I was talking with Curtis Marshall, and from Dental Intel, just one of the great metric companies out there. And plug, sorry, didn't pay me for that. But he goes, Hannah, the thing I love about you is when you coach to metrics, it's never about finances. It's about care. And I've always believed in that, and I've been very successful that way in my own career, is when I get behind what I'm presenting or metrics that I'm trying to meet, and it's all based around, my vision and my purpose, the numbers will 100% come. Yep. 100%.
Isn't that?
If you focus on those, and that's your focus, and must be productive, that's not it.
Yep.
It's just that's a job.
Yep. Yes. Yeah. Well, let's unpack this a little bit, because you bring a wealth of experience to the table. You've been a national speaker for over a decade and been a guest expert on several podcasts and in several publications. You're a member of the American Academy for Oral and Systemic Health, the National Network of Healthcare Hygienists, the American Hygiene Association, Dental Speakers Bureau, and the Dental Speakers Institute. So you bring all of that, but let's unpack. Where was your start? How did you get into this, and how did you end up here? What brought you here?
It's in the blood, and I know there are many of us out there. My father's a dentist, my grandfather's a dentist. All the girls went into dentistry. My brother's a chef, which is great. So when I say it's in the blood, now not everybody has to go into the family line of work, but this was, small town, Massachusetts, and back in, the 50s and the 60s, they were so different back then, right? My father went to all the schools. One of the elementary schools actually had a dental clinic. When we talk about access to care, that hasn't changed.
Wow.
Right? Access to care was, has always been there. It's like, well, we've got to do things differently.
Mhm.
And, so growing up in that field was, you were just exposed, right? And then it just became a passion. There was an accident that happened to a dear friend of mine while we were playing. One of those great big heavy old phones that you dial, clunk at a clunk. It was just, we were playing and it fell on her teeth.
Oh.
And I went running with her into the back door of my dad's office. I'm screaming, Dad, Dad, He's like, oh my gosh, that's one of my kids. Because 8 and 9 had snapped.
Oh my gosh.
And I was petrified and blood everywhere. And I'd ruined her mouth and her smile and the whole thing. And he said, nope, we'll get her right in here. And, we were there for hours. And I just watched, and I was a young girl. I couldn't have been more than 10, maybe 12. And at the end of it all, her smile was back. I hadn't destroyed her.
No.
My spirit was renewed because I hadn't broken my friend. Her smile was still there. My dad was like my hero. I'm like, that's what you do?
Oh.
Like, it was just profound. And, there's many inciting incidences in our lives, but as I move forward, everything I did moving forward was about dentistry. Every science fair, every project, every oral presentation I was all in. I got the bug, and I never looked back, and it's been amazingly rewarding for me. I've loved it, still love it. So, no intentions of retiring, just continue to live in the purpose and the vision and build that legacy that can be carried on.
Yep.
As my dad would say, what am I going to do when I retire? I mean, I'd like to slow down, I'd like to build things virtually, and I've got a lot of things on the back burner. I can, just tip my hat that I've got the Integrated Dental Academy is being built now. So there's courses to take. Yes, you can hire me as your coach and we can go through them together and coach the team, but you can also, once it's launched, you can go in and take your courses. You might say, wow, that was really great. Maybe we need to bring our coach in to really help us get that implemented. So there's different levels and everyone learns at a different level.
Yeah.
Some may say, you know what, I'm great with the course. We're just going to go run with the course.
Yep.
Some may say, love the course, love the information, need support getting my team on board, and where's everybody at? So I know I get sidetracked, Laura, so thank you for.
Yeah, no, that's fantastic. So what sparked your interest in integrated healthcare and getting the medical and the dental community to talk?
These things, it goes way back, right? And, bear with me as I do talk about my hero, my father, but he would sit in the den and for pleasure, he's thumbing through the Merck's manual.
Oh.
He was, a true physician of the mouth. He wanted to know, so much. And as I came up in my career, I was in Boston, and Boston is just such a huge collegiate teaching city, right? We've got great colleges, we've got great teaching hospitals. I don't need to name drop all the Tufts and Mass General and Harvard and BU and BC and all that, but I'll drop those in. But it became apparent and this was, back in the 80s and 90s, when I would get patients that were coming in for dental clearance to have a procedure done. I was like, woohoo, but why isn't this more widespread? Right? Yes, you needed dental clearance to have your knee replacement done. Fantastic. Because the bacteria that's going to be kicked up and released throughout your procedure with intubation and all that from the mouth is going to affect that knee. Why not be preventative about it? And we should all be preventative about it, especially with the oaths that we take, right?
Right.
To prevent the disease, not treat it afterwards.
Yep.
That's why we were, for years and years, we were doing antibiotic therapy prior to dental treatment, was to prevent any infection getting to the knee or the joint or, all the other things that we know we would pre-med for. And I don't want to go down that rabbit hole today. But I started to see that more and more. And it was very profound to me that it's all one system. And I had one big case of a woman who was going through, to save her life, she had leukemia. She was going through bone marrow transplant.
Okay.
And Google it, look it up, but it's extremely intense.
Mm-hmm.
And she needed dental clearance, and she needed 0 dental infection and bacteria.
Oh.
And she came in, and my doctor and I worked very, very closely. He said, with your eye, he goes, I want you to spearhead this. Oh. And I did, and I was thrilled to do so.
Mm-hmm.
And we did. I mean, we took her through the paces. I mean, there was no watch. We didn't watch anything. We treated everything. We were extremely proactive. Mm-hmm. And knowing what she was going to be going on the other end, we were also extremely preventative. Mm-hmm. And helping her to maintain afterward. And I'll just never forget when she came in afterwards, after she got out of the hospital from her bone marrow transplant, had on, all wrapped up in a blanket, and, really not 100% recovered, out of the hospital.
Yeah.
And she wanted to come see us.
Mm.
And I thought, of all the things that you've been through, mm-hmm. you want to come thank your dental team. Mm. As all of these things build in a career and you really understand the importance of oral health and mm-hmm. the oral systemic links and how important they are, and that you do change lives. Mm-hmm. That's the why. I do change lives, be it a friend, be it a patient, be it a family member. I've changed family members' lives. Mm-hmm. I've had friends come up to me poolside. Mm-hmm. What's all this, stuff you talk about with the mouth and the body? Because I'm having some health issues, and they told me I need to go see a dentist before they'll run any tests. And that goes into a whole nother story of I was thrilled to help them, mm-hmm. to help them through it and to explain it to them at the pool.
Right.
Or, a family member that has a heart attack and saying, you need Dr. Bale's book. You're not being treated correctly. I'm scared. You're going to die. Mm-hmm. Or another friend with, what do you mean I need to be paying attention to this inflammation in my knee? It's my knee. What's it got to do with anything else? I said, you're, a middle-aged, overweight woman with a lot of stress in your life. That's just screaming heart attack to me.
Yep. With
your family history. Why doesn't the medical community recognize, that inflammatory cascade and the dangers of it? Mm-hmm. And why doesn't the dental industry recognize it more? And even when we do, then do something about it. What are we doing? What action items are we taking? Because we've got the way we've always done it, and we need to do it a new way. Mm-hmm. We need to bring it into the future.
Yep.
So I would ask, develop that sense of urgency, which is one of my 5 to thrive. It's, you have that patient, you have that cardiac patient, that diabetic, that borderline Alzheimer's. I mean, pick the host of oral systemic links that we know.
Right.
And they're in your chair and you're discovering oral disease of any type, mm-hmm. hard tissue, soft tissue. And we know that that's going to create an inflammatory response in the body. Mm-hmm. Put the brakes on.
Yep.
Do we know who their cardiologist is? Their endocrinologist? Are we ready to communicate with them? Are we ready to start bridging that gap with a letter or a phone call or a fax? Mm-hmm. Are we ready to get ourselves known in the community? We're going to run into resistance, guaranteed.
Yeah.
You've got the cardiac patient that you're sending to their cardiologist, and they're going to say, and this has happened, why is your dentist sending you to me? Mm-hmm. Right?
Yeah.
This is another opportunity to, hi, Dr. So-and-so. Love to have lunch. Mm-hmm. Love to get together. Love to have you know what we're about. And helping to be part of the solution moving forward. What does that network look like? Are you perhaps having an open house? Kicking off the new year? Inviting in your medical colleagues and counterparts. Come meet us. Do you hear the squeak?
I do.
Well, at least he's not chewing my cords.
That's right. That's right.
So enlighten the mood a little bit, because I do. And I get passionate and I lose my weather girl because, to me, it's that serious though.
Yeah.
And we're going to run into barriers. What do we do
Mhm.
with them? How do we overcome those barriers in a world that's not ready for that, but knows that it needs it? You can either look into things, or you can, there's many of us out here. I come from a place of abundance. There are many coaches that are coaching to how to be integrated, how to be interdisciplinary. How do we set these things up? And we're all here to help.
Right.
To bring systems and strategies, proven systems, because it's not willy-nilly. You need a system. Right. Just like you do with everything that you do in your office. What's our system for that? Because we need that blueprint to follow. Right? And we need to be able to implement that.
Yeah. So a couple of things that you said that made a difference to me is when you talked about that patient that came back to thank you after her bone marrow transplant. Right there, when you meet resistance, you remember her, right?
Oh yes.
And you and that fuels you to continue to build those bridges and network and form those relationships with the medical community, because you know that there is going to be another patient just like her with maybe a different situation, but someone that you can change their life, right? And so, so let's say, you have a practice, a dentist that's interested in doing this, and they reach out to you and they're curious how to start this. What would your answers be? How would you point them in the right direction? How would you help them?
I would start by saying, you know what, let's get on a call. Let's get on a discovery call so that, and I love doing, Zoom calls or Google calls so that we can get that face-to-face. And I want to know more about what it is that you need. How can I support you? Because I can bring systems and structure into every aspect of your practice. Nice. I want to know what your concerns are. And I do advocate for vision and purpose, because to me, that's the old phrase, master the basics, right? We have you can put master the basics to so many different aspects, and I have, right? Yet to me, that is the basics. So, what is it that you feel you need support with? Let me get into what are your top 3, and we can integrate that into, some beautiful coaching sessions, because I can't dive into, let's say we're talking about case acceptance, right? I can't dive into case acceptance without starting with your vision and your purpose, because it's all part of it. I can't dive into, I can, supporting your hygiene department without backing up to your vision and your purpose. Don't get me going on hygiene, right? That's just, it's always been a passion. And as a clinical hygienist, it all has to back up to that, because you can do all those procedures, but when you have to show up with how you're being, if we break it down to the be, do, have, right? Which there's a lot of research out there on that. It says, how am I showing up so that I know I can do these things? And when I say I coach to metrics without talking about finances at all, I do, because that's the have. And when you conquer those first 2, I coached hundreds of teams. I just feel like there's going to be people in the background going, there's no way that can happen. I'm like, it does. I've coached hundreds of teams throughout the country. And it's like, it does, it works. It's just there. Yep. If I have a patient in that, is a new patient, and we get to, diagnosing any kind of dental disease, say it's periodontal disease, and I have a cardiac issue or a diabetes issue or whatever, and I'm going to recommend something other than that free prophy, I will put the brakes on. I will make sure that the patient is educated, that the doctor is educated, knows where I'm coming from. It's that alignment as well, right? That they know that I want to communicate with their cardiologist or their primary care physician, and what the proper treatment is. And I would be just as happy to have that patient walk out, and dentists out there, you're going to be like, no way, Hannah Coffey. Yes way. You can walk out of there with a 0 for production for that patient. You can.
Yep.
Because they're going to come back for the proper treatment.
Mm-hmm.
You're not throwing in, a stent for somebody who needs open heart surgery. You're not doing a Coffey for someone who needs scaling and root planing. They will come back.
And they'll bring their friends and relatives too,
yes,
right?
Yes. Because, wow, I've never been to a dentist like that.
Mm-hmm.
I got this whole folder. No, they didn't do anything. They were worried about me.
Mm-hmm. They
were concerned about my health.
Yep.
About my knee, about my heart, about my A1C.
Mm-hmm.
So
yep.
Making sure that we're lined up that way, that's really where the future is going. We need to step into this and be able to meet the resistance head on, be able to have the systems and structure to power through it.
Mm-hmm.
It's not always going to be a win. It's never always a win, right?
Nope. Nothing in life
is, right? The win doesn't mean you don't try again.
Right.
Again,
right.
And again, and again.
Yes.
We keep moving into the future. We keep moving into the future with urgency, because that is where healthcare needs to be. Mm-hmm. We need to be preventing it from the get-go.
Yep.
And then maintaining it once it's there.
Mm-hmm.
That's our job.
Well, now, don't you think it's even more, I think more people are aware of this because of the fact that COVID has highlighted the importance of our immune system. And the fact that these conditions leave us at higher risk for negative side effects from COVID, the heart disease, the diabetes, the inflammation.
Yes.
And so now I feel like the general public is a little bit more aware of things that they need to do to increase their overall well-being. And what a beautiful opportunity for us in the dental world to highlight the fact that we can be a big player in this as well.
Yes, absolutely.
And a teammate, right? Teammate with the medical community.
Well, and we had so many people in the dental community that said, I cannot believe that we're being deemed non-essential. We are the gateway
Look at that.
to the respiratory system. This is a respiratory virus. Why are we non-essential? So, as we get ready to wrap up, I want to say, be essential.
Oh, yeah.
Put yourself out there. Don't allow yourself to be non-essential. Scream from the mountaintops. Get involved. Do things differently, right? There are a lot of us out here that are.
Yeah.
And that's healthcare. It's head to toe.
Yes.
The body doesn't start here. My dad used to wear a button that said, I'm a real doctor. And doctors, right?
Yeah, right.
Right.
So, well, and the physicians don't know a whole lot about the mouth, so they're relying on us to, they don't want to have to go through another residency to learn about the mouth. They're relying on us to help them with that piece of the puzzle. I mean, it's just like going to your family physician and they refer you to the cardiologist. They refer you to the, so if we envision, like you say, vision is so important. If we envision ourselves as that person, we can.
And it is about building that network, Laura. It's about having a patient that you may have some concerns about. You took their blood pressure. It's getting high. They've got periodontal disease. They don't have a primary care physician. They don't have a cardiologist. Mm-hmm. Are you letting them walk out the door, or are you going to make a recommendation for them?
Right.
Are you going to get them some literature, help them find a cardiologist or a primary care physician so that they can get the proper care to treat the whole body?
Yeah.
And vice versa, as we continue to bridge that gap, is getting with our medical counterparts and colleagues, and please do more than have them open their mouth and take a peek around with your tongue depressor. When's the last time you were at the dentist? Within a year? Yep. Good. Done.
Right.
And say no. Like the gal with the poolside, I call it poolside patient education. Her doctor would not go any further until they had communication with the dentist and the dental infection was being addressed, so that everything else would. Why take all these tests when you've got this raging infection and your numbers are not going to be accurate?
Yep.
We talk about, all different things, and I could go on and on, C-reactive protein and investigating where everything is coming from. So it really is. And if they don't know, help them, educate them. Like I said, go to lunch, let's build a network, have the open house, have an action step.
Yep.
Right? Because we're all in this together.
Yeah.
And we can have healthier patients and societies and communities.
Yeah. So is that part of your coaching support, is helping dentists in how to communicate with the physicians and how to set up those bridges? Do you have systems and
absolutely systems and templates? It's, we have a template for, this is for your primary care, this is for your cardiologist, because we're going to co-treat, right? And you want to be able to express your concerns about what you're seeing. And, there's several different systems to implement to finding local healthcare providers for your patients as well. So starting to be part of that solution.
That's awesome, because, I think that is just so valuable, in that when you're in your practice and you're busy seeing patients, sometimes just figuring out these logistics can prevent you from starting something. And so to have the support of a coach that is there to say, hey, you don't need to reinvent the wheel. I've got these, I've got you. And I can share this with you, and you can tweak it to your vision and purpose in your practice, right? Right.
Absolutely. And that's why I love that discovery call, because it's not cookie cutter. And you want to customize it. What are your concerns? What would you like to work on? And are you open to where I feel we can go with this? Because, when you're in an industry for so long, and I'm not saying I've seen everything, but I've seen quite a bit in the last 45 years, that you can, you make adjustments, right? You know, what do they call that? Bob and weave, or, pivot. We're still doing the pivot, right? So pivot, right? And it's like, okay, well, but this is my main concern. And I love working with the doctors and getting the team involved, and even getting insight from different departments within the office. I'm like, all right, now we've got all of this. And now how are we going to blend this all together? And so many different amazing things that we can do with teams, to get them aligned and get them the successes that they're looking for. End game is health.
Yes. Right? And you mentioned that with this is sustainable in a practice, with growth, with economics, and like you said, the metrics, if you're working with your passion, the metrics follow. So explain a little bit about how that affects their practice growth.
So, when we talk about economy of scale and how are we going to be able to grow this, it's, there's so many different metrics that we can look at. And oftentimes people are like, well, we had, 11 new patients this month, right? And that may be low. I'm just throwing numbers out there before everybody gets all, it's like 11, we want 11 a day. But okay, so we had that come in the front door, but what went out the back door? How are we keeping them in the practice? When we look at that practice growth and making sure that, as I said, we're not bleeding out the back door. And there are different ways that we can do that. I mean, this goes back to, I learned this as a teenager, right? No one leaves without an appointment. Ever. Ever. It's like, well, but they're a denture patient. It's like, yes. And the denture will need to be cleaned, and they'll need to have an oral cancer screening, and they'll need to, just because you get a full upper and a full lower denture doesn't mean you never go back to the dentist.
Yeah.
It just doesn't mean that. So, it's I'm going to tell you that there will be times when, okay, someone's not going to make an appointment. But when you start to build that into your standard of care, that it is the routine that people are getting that appointment, it's going to lessen the amount of people that you need to work on the back end, the amount of patients that need to be reactivated and brought back in. And if you want to have your systems giving you accurate data, keep your data clean. right? It's like, oh, they passed away last year. Then why are they still in the system?
Yeah, right.
Oh, they don't come here any longer. Take them out of the system. We want to be able to look at true active patients, true patients coming in the front door and stopping them from leaving out the back door of our existing patients. So there's a lot of different things that we can put into play and analyze and find out where that miss is as we begin to scale and grow. And it's allowing yourself that time and space. It's building that productive schedule. It's blocking that schedule to leave room for the patients with urgency. You don't want to be that hygienist out back going, my gosh, you've got this infection. We've got to make sure that we get this done. I'm going to send a letter to your cardiologist, bum, bum, bum. And then they get up front and it's like, oh, we can see you next month.
Right.
It's like, all right, this raging infection that's doing so much damage. What do you need next month? And taking away that fear of blocking schedules or taking away that trepidation that some might have with, I got to get something done today. Right. It's like, no, it's okay. And I know I talked about that earlier. And I love to tell the story. Like if you looked at a toddler and what they ate in a day, some days you might be horrified, right? Just might have had a day. It's like they had chocolate cake for breakfast and, whatever. Yep. But if we look at what they ate for the week or what they ate for the month, it's like, okay, they got their nutrition in, they got their vegetables, they got all that. Don't always, yes, we're going to have goals and benchmarks that we want to hit. But in the long run, you'll hit them.
Yep.
I hope that's coming across the right way.
No, completely. Yep, completely. And in the long run, you'll be helping and taking care of patients better. That's and that affects everything. That affects the front door, affects the back door, and it affects your joy at the office as well, I think, right?
It truly goes down to doing what we know we need to do, because that's the oath that we took.
Right.
If I have a patient that has a known infection, hard tissue, soft tissue, and I'm not doing the treatment that I know that they need for whatever reason, I want them to like me. It's too expensive. I'm going to just present it in bits. All the different things that we face. We have to know that with the research that's available to us, to not present that, it's wrong.
Yeah.
You have to say it's wrong.
And then that's where you start to have that stress, because deep in your heart, you know what's right? And so it's just like what you say, when you're living personally and professionally with your vision aligned, that's the magic. That's where the magic happens, isn't it?
Yes, that's the balance, right?
Yes.
That's the balance, because that's going home at night, going, I did the right thing today.
Right.
Not going home at night and jumping onto a social media and just blowing off steam because of the bad day you had.
Right.
We're all going to get in the weeds. That's just going to happen, right? But it's how we deal with it, how we feel about it, and did it line up?
Yeah.
Exactly. Crazy day. Oh, we were so in the weeds, but it still felt good.
Right. Yeah. Oh, that's a beautiful way to put it. I like that. All right. So we're kind of running out of time. So I'd like to just make sure, number one, you're offering a complimentary 60-minute discovery call. So I have your email there. That's the best way for them to get a hold of you, right?
Absolutely.
Okay. And I'm really excited to hear about this academy. And will you please let me know when we can announce that for our members? Yes. I'll definitely make sure they get that information when that's ready. That sounds awesome. So
thank you. I appreciate the opportunity today to, get that message out there and share my passion, and a couple of stories in there. And don't forget about the puppy who's down here just chewing away. So I'll be able to take a look and see. Hang on.
Oh, where's Tank?
Say goodbye, Tank.
Hey, Tank. He's so cute.
I've been good, Mommy. I've been good.
Yep. You need a new computer cord, but other than that, he was a good boy. Oh, well, Hannah, thank you so much. And I will make sure that all of the links to reach you are in the comments below. And please, anybody, if you have any questions for Hannah, you can put them in the comments below, or you can reach out to her personally. She is a joy. You will not be disappointed if you work with Hannah. She will bring her A game to every encounter with you. So I highly recommend her. And thank you for taking the time to talk about this important topic.
Thank you. I really appreciate the opportunity to continue, with the mission.
Yes. Awesome. All right, everyone. Cheers, blessings, and balance. You guys have a great day. Bye.